of the victims of the worrisome cases of cholera epidemic that has ravaged some parts of the country, especially the northern region. From Borno to Yobe, Adamawa, Kano and Oyo states, the number of cholera cases and deaths is alarming. As at the time of this report, efforts to get statistics from the Federal Ministry of Health did not yield any fruit. However, data from the World Health Organization shows that in 2010, there were 44,456 reported cholera cases in Nigeria, with 1,712 deaths. This is mainly as a result of fecal contamination of water sources during rainy season and flooding in rural areas where safe drinking water and sanitation facilities are scarce. The sources of water for Nigerians in these communities include water wells and rivers where people wash and at the same time have their bath. Exposing them to cholera bacteria as experienced by Hajia Abubakar.
If you are just sitting down or doing work in farm, you start feeling something going down, up, and after you start to vomit. After vomiting, you start to purge. So by that time you come out of your sense.
It can be disheartening that despite the simplicity of the prevention and cure of cholera, hundreds of people have lost their lives for reasons ranging from ignorance to poor general and personal hygiene and lack of access to clean water, which is a basic necessity of human life.
The problem with cholera, you have to understand the problem with cholera. It has to do with water and sanitation. Now, simple measures will solve it. If we can ensure that even where we have wells or boreholes, simple chlorination, simple treatment is not an expensive thing, can help. That would take care of germs. Then ensure we build latrines. First, the individuals can do that. If we ensure that we obey the laws of the country and enforce them, every landlord, anybody that builds a house, either for himself or for tenants, must have this. That is an easy thing to do. Communities can do this for themselves. The Ministry of Environment can also assist. Ministry of Rural Development in each of the states. These are local government. Building toilets should not be for federal government. There are things the federal government can do. Build large dams, which we are doing. Continue with advocacy, continue with support, technical support to state governments. We are doing all those things.
While the government is expected to tidy up its own end in ensuring good public health, general and personal hygiene, and food safety are a few things you can do to protect yourself as parabacteria thrive in dirty environments.
Cholera is fecal-oral. When you take it, it's not airborne disease, it's go direct to the mouth. So personal hygiene is the first thing, especially the water hygiene. When you take the water, you make sure it is pure and clean. When you eat something, you make sure it is hot. Don't eat anything that is cool. Don't leave your food open for flies and other things. That's the only advice I will give to person. So personal hygiene is the most efficient for the cure of cholera. And washing hand before eating food. Everything when you want, you have to wash your hand before you eat everything.
Community leaders also have their jobs cut out for them in the area of public awareness campaigns that must be intensified and sustained. As the rains approach, clearing the drainages for free flow of water is a good idea that should be embraced by government at all levels, and the people would do themselves a whole lot of good by refraining from indiscriminate dumping of refuse. Yomi Otaibu reporting for Channels Television News.